clear idea regarding this.
Okay. So, you're right. You came to us with some swelling in your right leg. And after examining you, we did a scan or imaging of your leg, of the blood channels of your leg. And we found something unexpected.
Oh, what do you mean, doctor?
Actually, we discovered that you have a clot in your blood channels, and this condition is called as deep venous thrombosis.
Oh, doctor, it seems very complicated name. Is it something serious?
Well, I appreciate your concern. Actually, it is something quite treatable, but it can be serious if left untreated. Fortunately, we have picked this up early, and we are going to start you on the appropriate management plan, which I will discuss with you shortly. But before that, I want to know, would you like to know more about what this condition is about?
Yes, yes, please, doctor.
Okay, well, like I said, that this is a condition in which there is some clot formation in the channels of your blood channels of your leg, and it can be caused by a multiple reasons. Um,
Assalamualaikum, Dr. Ali.
Hello.
Yes, yes, Dr. Kumal. So please, guys, do not unmute your mics.
It can be caused by a lot of reasons. We will further try to find those out, but the main symptoms that you can experience with this clot formation is swelling and pain in your leg, and and there can also be some warmth over your leg, or redness as well, right?
Okay, doctor.
So some of the complications of this condition can be, the more serious ones are that the clot can break off and it can travel to your lungs. In that condition, what can happen is that you may experience sudden severe shortness of breath, and in really bad cases, it can even cause your blood pressure to lower down. It can cause your racing pacing of your heart, and unfortunately, the most serious complication of this is death. I'm so sorry to tell you about this, but if not
Oh,
treated timely.
doctor. So do you think I'm dying now, doctor?
Well, Mrs. Martha, right now we have picked up the condition early, and we have checked all your signs like your heart rate and blood pressure. And right now, you seem well. You're not short of breath or having any dizziness or any serious symptoms. Am I right?
No, doctor, I don't have anything like this.
So, what we have decided is that we have discussed your case within our team, which also included my consultant, and we have decided you to start you on a particular medication.
Okay, doctor, that's fine. What kind of medication are those?
The name of this medication is dabigatran. It is a type of a blood thinning medication. Um, would you like to know more about it?
Yes, please, doctor.
Okay, well, it is the best medication available at the time being for your condition, and the benefits of this far outweigh the risks, and it is going to help prevent further clot formation in your leg, and also help to um, dissolve the clot that has already been formed. It will help to prevent its further progression, so that the already formed clot can be broken down by your body, right?
Okay.
um like all medications, this also has some side effects. May I tell you more about that?
Yes, yes, doctor, please.
Actually, since it is a blood thinning medication, it can cause your blood to become more thin, than required. But what we'll do is we'll keep you under regular follow-up, and we will monitor you by calling you regularly and keep a check on that. But in case that you notice anything going wrong, like any bleeding from anywhere, you have to come immediately to us. Right?
Oh, okay, doctor, but it seems something really serious. Do you mean it's a kind of blood thinning medication? Am I right, doctor?
Yes, yes, Mrs. Jones.
Okay, doctor, I'm really afraid of those kinds of medication, doctor. I've got a friend who received blood thinning medication and she ended up bedbound because of brain bleeds, doctor. I'm really afraid to have the same.
Okay, well, that is very valid. May I know that, do you have any idea what was the name of that medication?
No, doctor, I don't have any exact idea, but I'm not sure whether it's the same medication or not. But what I know that it's a kind of blood thinning medication.
Okay, well, Mrs. Jones, there are a lot of blood thinning medications that are available, and the one that we are giving you is a newer kind of medication that is much safer than those that were older. And we at the moment we do not know exactly which medication your friend was taking, and whether she was taking the full precautions and having regular follow up. But let me assure you that in your case, we are going to keep a close check on you to prevent any of such complications from happening.
Okay, doctor. So can you guarantee that this kind of medication will never give me brain bleeds?
Well, Mrs. Jones, nothing is 100% in medicine. Uh, I'm so sorry to say that we cannot guarantee it. But again, I want to assure you that with regular follow up and with regular monitoring, we can prevent a lot of complications, and we can even pick them up early so that they can be treated. But at the moment, like I said, that your condition of the deep vein thrombosis can be life threatening if the clot breaks off and goes to your lungs. So this, at the moment, starting you on this medication is far more beneficial than its risks, and it will help prevent any such serious life-threatening complications of this condition. Right?
Okay, doctor. But doctor, to be honest, I'm not. I don't feel that I'm convinced to take it, doctor. It seems very big decision.
Mrs. Jones, may I know why you're still not convinced?
I've told you, doctor. I'm afraid of such kind of medicines, doctor.
Okay, well, Mrs. Jones, I again want to explain to you that your diagnosis of deep vein thrombosis, if it is not treated properly in a timely manner, it can cause death on its own by the breakage of this clot, which, if large enough, it can block a lot of area of your lungs, and that can be resulting in shortness of your breath, and it can also affect your heart, functioning of your heart. So right now we want to treat you with the best medication that is available. We will monitor you to prevent and pick up any complications early, and this will be in your benefit in the longer run.
Okay, doctor. Okay, I will consider that.
Okay. So, well, you can think about it, but it's better to start this as soon as possible, right, Mrs.
Okay, doctor. Okay, that's fine.
Well, I wanted to say something else, that this medication, before starting it, we will have to do your tests, certain blood tests, which would include your liver and kidney tests, because the dose of this medication has to be adjusted accordingly. May I know if you have any such problems before for your liver or kidney?
No, not as far as I know, doctor. I used to be healthy.
All right, all right. So we'll still do your tests for that, and we'll regularly monitor them in our follow-ups. And another private question, may I ask?
Yes, sure, doctor.
Do you have any chance of pregnancy at the moment?
No, doctor, but I'm planning to be pregnant.
All right. Well, at the time being,
2 minutes remaining.
All right. So, but well, Mrs. Jones, your pregnancy should be planned. At the timing, it's best to delay it a bit because of your because we want to treat you properly, and after that, once the condition resolves, then we will involve the women doctor, and we would like to have a planned pregnancy for you. Is that fine?
Okay, doctor, that's fine.
Okay. So, well, Mrs. Jones, do you smoke or drink alcohol?
Yes, doctor.
May I know how much do you smoke?
Well, 5 cigarettes a day, doctor.
Okay, well, it's better to cut it down because it can be generally harmful to your health. If you're willing, I can help you in that regard.
Okay, doctor.
And what about alcohol? How much do you drink it?
Yes, doctor. I'm drinking within the weekends, doctor.
Okay, it's within the limits.
Yes, doctor. I've never exceed the limit.
Okay, well, Mrs. Jones, may I know if you have any more concerns for me?
Well, doctor, I'm just concerned whether it's something harming my baby. I'm lactating now.
Okay, well, Mrs. Jones, that it's good that you've told us about this. I will have to review. I'm afraid I'm not quite sure whether it is secreted in the breast milk or not. But I will talk to my consultant about this and get back to you at the end of our meeting. Is that all
Oh,
right with you?
okay, doctor, that's fine.
Do you have any other concerns?
No, doctor, I'm fine, thank you.
May I know that, like, where do you live? Is it on the first floor or ground floor?
No, third floor, doctor.
Would you need any help?
Time up. Okay, that's fine. So, Dr. Kumal, what's your scenario about?
My scenario is about Mrs. Martha Jones, 45 years of age, who is recently diagnosed with deep vein thrombosis, and we're starting her on the newer oral anticoagulant dabigatran. I had to tell her about the diagnosis as
Mhm.
well as about the medication and address her concerns.
Okay, how do you think your scenario went?
I think I was able to convince her about I told her about the diagnosis in detail and also that it could be life threatening if not treated. And I told her about the medication as well. And she was saying that I'll think about it.
Okay, that's fine. Did you offer help regarding regarding that? She's going to consider thinking about this medication. Did you offer a meeting with a consultant or did you offer any kind of leaflets and brochures regarding this or not?
Yes, I wanted to offer it. I ran out of time. I also wanted to offer help for her because she's living on the third floor and it can
Okay,
be difficult mobilizing. So I want to offer help for that as well.
okay, that's fine. So the second thing is what could be the legal issues within your scenario?
Um, The legal issues could be the consent for starting the medication.
Okay, is it
And
written consent?
no, it would be a verbal consent.
Once it's verbal consent, so it's not a legal issue.
Okay. Um, I cannot think of any other.
Okay, do you have any fixed legal issues so confidentiality and capacity would be fixed in every single scenario.
Okay.
Any specific legal issue, Dr. Kumal here?
I cannot think of any. Or
Okay.
we maybe I
Oh,
should have stopped her from driving.
yes. She got right leg DVT. Do you think that she would be able to drive with right leg DVT or not?
Yes, I missed that.
Okay. Do you think it's something important?
Yes, yeah. I should have
Okay.
told.
What does she do for living?
Mm,
She's playing gymnastics.
oh, okay.
Okay. Do you think it's something important or not?
Yes, I should have told her. Um, I should have told her to stay away from her job for a certain, like for 6, I'm not sure for the time period.
Okay, you don't have even to give a time period if you are not sure. But once your patient gymnastic trainer, she
Mm.
wouldn't be able to play gymnastic while she got DVT and while she's taking oral anticoagulant as well.
Okay, yes.
Okay, so this is something really important. So your main weak point was the history, Dr. Kumal. I'm almost always telling the same in every possible free session. I'm telling you guys history before the management plan, and I'm telling you remember that better than your surname. History before the management plan in station 4. You've missed that she's lactating. You've asked about the pregnancy very late. You've missed driving. You've missed job.
Okay, Dr. Ala, I asked her about any chance of pregnancy.
Yes, I've told
She
you
said
that
I'm
you
planning.
you picked the pregnancy very late.
Okay. That's
Okay.
why you said the lactating part.
Yes.
Okay.
Okay. So let's comment upon the scenario generally. You've done very, very, very good, Dr. Kamal. So let's start from the beginning. As usual, I'm commenting about every single word. So the first thing that you've told her, unfortunately, that the imaging or scanning revealed unexpected thing. So nothing called unexpected for you as a doctor. Why you've done Doppler? Because you are expecting DVT. Am I right, Dr. Kumal?
Yes, you're
Okay,
right.
so
Mm.
nothing called unexpected. This is the first thing. So the second thing that you've start explaining the DVT in a very good way, but I'm going to prefer that if you've draw for her anything, like these
Dr.
are
Ala,
your
before that, can you please tell like how should I have broken the news to her?
okay. I'm really sorry to tell you that the result it's not as we hope.
Okay.
It's not as unexpected. No, it's not like we hope. So
Okay.
what's your hope, doctor? To find everything normal. Unfortunately, we've picked certain abnormalities. It's called deep vein thrombosis. I'm sorry for the medical term. Would you like to know more about this? Yes, please, doctor. These are your blood channels supplying your legs. We've got some blood channels called veins. Unfortunately, you've got clots just obstructing your veins. As simple as that. It could be related to many causes. And for that, we are going to form a multidisciplinary team regarding your management, or never mention multidisciplinary, of course. We are going to mention a team from doctors from multiple specialities just to give you the best management and to dig deeper regarding the cause. For the time being, I would like to explain more regarding this problem. So explain the DVT, signs and symptoms typical to your presentation, and then the complication, it could be varies from very simple or no complication up to a life-threatening complication, like dislodgement of the clot, which is may transfer everywhere to the body, especially the lungs, giving serious problem. I'm sorry to tell you that. Then Dr. Kumal, she asked you, am I dying? What you've answered her, you've told her, well, we've picked your diagnosis early, and now you seems well. You did not show any sympathy for her question, Dr. Kumal. She told you you've just explained for her that this condition it could be fatal, and she asked you, am I dying? You have to show sympathy. I really appreciate your feeling. Thank you for sharing your thoughts with me. Do not tell her, well, we've picked that early and you seems well now. Did you get the point, Dr. Kumal?
Okay, can you tell me how I should have said it?
Okay, am I dying? I really appreciate your question. Thank you for sharing your thoughts with me. For the time being, we've picked the diagnosis early, and be sure that we are going to be beside you, supporting you, giving you the best management throughout your illness. As simple as that.
Okay.
Okay. Then you've asked her some clinical questions or clinical history. You've told her you don't have any dizziness or shortness of breath now. Am I right? Imagine that she will tell you, yes, I've got shortness of breath. Are you going to convert this station into station two?
Okay.
Okay. So Mrs. Martha has been seen by your consultant. You are not allowed, Dr. Kumal, to ask her. Hello? Is my
We
voice
can.
clear, guys?
Yes.
Yes, madam, clear.
Okay. So, Dr. Kumal, you are not allowed to ask her further question after your consultant. Okay. So, just educate her regarding the symptom. Do
Madam,
not ask.
we cannot hear you.
We can hear
Hello?
her. We can hear you.
Okay. So, is it clear?
Yes.
Yes, ma'am.
Okay, that's fine. So you are going to advise her regarding the symptoms and do not ask whether she got the same symptoms now or not. Okay, then after that, what I've wrote here, okay. Starting the education regarding the medication, Dr. Kumal, you've mentioned that the benefit outweigh the risk. You did not mention the benefit, you did not mention the risk. You've started with the sentences, which is it's not accurate, it's not its place, but that's fine. Then you start explaining the management plan before the history. Then she told you, doctor, I've got a friend who has a bleeds, brain bleeds because of blood thinning medication. Sorry. Again, Dr. Kumal, you did not show any sympathy for that. She told you she was completely healthy, doctor, and now she's bedbound because of brain bleeds. You did not show any sympathy. I'm sorry for your friend. I'm really sorry for what happened for her. So instead showing sympathy, Dr. Kumal, you've told her what kind of blood thinning that she's taking. Do you think it's a clinical history here or not?
No, you're right.
Okay, so it's not a valid question. She's just sharing her thoughts with you. So you have to show sympathy. You have to tell her, I'm sorry for what happened for her, but be sure that we are going to support you. We are going to give you the medication with controlled doses and regular follow up. Just be sure that we acknowledge that every medication comes with side effects, and here the place for your sentence, which is the benefit outweigh the risk from those medicines. She kept refusing, telling her exactly like you've told her, I'm sorry to tell you that if this problem kept without treatment may danger your life and may give you multiple problems. Then at the end, it's a wrong place for the history, by the way, and you've asked her questions like, do you smoke or drink alcohol? Two questions at the same time against your communication skill. So the skill of the communication, if you've asked two questions at the same time, the examiner will deduct mark from this skill, either in
Dr.
station
Ella,
4.
you said 2 minutes left, so I was not sure whether what I should skip it or and go straight to the concerns.
So you, okay, once you've got 2 minutes left, you have to ask about the concern. If the patient has no more concerns, you are going to ask about the most important things. The most important is asking about the occupation and driving rather than asking about smoking and alcohol. If you are dealing with warfarin, I'm going to tell you asking about the alcohol is a must. So
Okay.
here within the Bigatran, you are going to choose your priority if you don't have time. And you don't have time because you did not take the history in the right place. The history before explaining the management plan. Because once you've explained the management plan, she will raise too many concerns. She will raise too many refusal. She would be reluctant. So that's why I'm telling the history before the management plan. So once you start explaining the management plan, the surrogate will consume your time. Did you get that, Dr. Kumar?
Yes, and Dr. Ella, like you said, I should have taken history before. So how do I sound like I'm not taking the history
Okay, so
while asking this?
you've got two kinds of history. The first type of history is the history that may change the diagnosis, the history that may add points upon your consultant. And this kind of history, it's not allowed, it's completely forbidden. The second type of history, that the history that I'm going to offer help after it immediately. Like what? Like, what do you do for living? So you have to stop your job for the time being. We would be able to issue a certificate for you after informing the occupational worker. Okay, so do you smoke? Please, smoking is very dangerous for your health. Try to stop smoking, and we would be able to help you. Another help. Do you drink alcohol and you exceed the limit? Because if she's exceeding the limit, you are going to offer help again. With whom do you live? Are they supportive? Because you are going to offer help again. Then, after that, the most important thing here, are you pregnant by any chance? Because if she's pregnant, you, sorry, or are you planning for pregnancy? Because if she's pregnant or planning for pregnancy, this is something needs to be reviewed by the management team. Are you lactating? Because lactation as well contraindicated within the novel anticoagulant. So simply, that's why you are going to ask those questions in terms of offering help, not changing the diagnosis, not adding point upon your consultant. Is it clear, Dr. Kumar?
And all of this should be before I talk about dabigatran.
Sure. Okay.
Hello?
Yes, yes, Dr. Kumar.
Okay.
Sure.
Okay. And
History
Dr.
before
Ala,
the management plan. Yes.
what about like these medications also have to be adjusted for liver and renal problems? Will I ask
Yes.
about that?
Brilliant. So you can ask about this, whether you've got any previous problem, or you can just tell her, like you've told her, which is something brilliant, that we are going to do certain tests, including your kidney function and your liver function, just to know whether the dose would be adjusted or not.
Okay. And would we also take a medication history or is that all not allowed?
Okay, no need, because there is no specific drug-drug interaction with the oral anticoagulant or novel anticoagulant.
If there is, then we should.
Sorry?
If there is an interaction, then we should take the
Yes,
drug.
like if you are going to consult on the warfarin, you have to ask her whether she's taking any kind of medication or birth controlling pills, because there are some interaction, and you have to advise her, do not take any kind of medicine or herbal remedies till you will inform your GBs, even if it's over the counter medication.
Okay,
Yes,
thank you.
Mr. Rara. Hello.
Okay. Yes,
Uh,
Dr. Sami, please give me a few minutes. I'm going to open the door for the questions. Okay, so Simply, how shall we approach such cases? So, first of all, I'm going to start with the introduction, then explaining. Any explanation, we've agreed that we have to discuss the normal physiology. These are your blood channels supplying your leg. Okay, the definition, it's a clot within the leg itself. Then the cause, multiple causes, and we are going to follow up you. We are going to keep eye on you, and we are going to dig deeper regarding the cause, and all of those things will happen by the multiple specialities, doctor from multiple specialities. And then sign and symptoms typical to your presentation. You don't have to mention too many signs and symptoms like leg pain, leg swelling, and so on. Just mention that the signs and symptoms typical to your presentation. Then all of those things supported by the scanning and the imaging. Then the social history, the most important parts within the social history, apart from the usual social history, which is what do you do for living, with whom do you live, are they supportive, do you smoke, do you drink. You have to add pregnancy, lactation, and past medical history. Why? Pregnancy and lactation contraindicated. Past medical history because of liver problem and renal problem, and you've done that in a very, very, very clever way. Then after that, you are going to explain the management plan. Why we need this management plan? This is the most important thing, just to prevent further complication, just to thin your blood. This is something really important. Then what if this management plan not taken? I'm sorry to tell you, it's going to be very dangerous for your life. Then after that, follow up and precautions. One of the precautions that you have to mention, dehydration. So you have to keep yourself well hydrated after this medication. You have to drink plenty of water, because dehydration may give the patient a kind of toxicity or drug overdose. So do not be dehydrated. And dehydration may affect the kidneys as well and affecting the drug. So this is one of the things that you have to mention. Drink plenty of water. The second thing is the compliance. So tell the patient that those kind of medication go a very, very short half-life. So once she missed any dose, she would be considered non-anticoagulated. So just keep in mind that she has to be compliant. Do not miss doses, please, because this is going to be problematic for your condition. Those are the most specific precautions that you have to mention. At the end, recap and close if you got time. If you don't have time for the closure, that's fine. And check the understanding is a crucial. Is it clear, Dr. Kumal?
Yes,
Doc,
Dr. Ala, it's clear. I wanted to ask that sometimes patients have a question that if I miss a dose, then what should I do? Should I take it immediately or should I take a double dose?
okay. Once you've missed the dose, you have to take the dose immediately. Do not double doses.
Okay, and the next should be on the same time as before.
Yes, the next would be at the same time. But please, you have to keep yourself with a reminder. You